Hi, my name is Mohammed Rampag. In this video, I'm gonna represent my learning in blood cells, microscopy or histology in different terms. And um, in the lab, in order to see our blood under the microscope and see its component, is to take a blood sample first and put one drop on the sliding board, a sliding glass and spread it over the glass and let it dry and do the staining techniques to stain the blood sample because the staining help us to have better and beautiful illustration of the blood cells and when we put the sample underneath the objective lens we would see this beautiful image but in colorful version, but this one is not colorful, sorry for that. So this is a bunch of cells, the majority red blood cells combined with kind of nucleus type cells, bigger one or a smaller one is like a star. This is called platelets and lymphocytes or white blood cells. So for the better illustration, it's a zoom in one. We can see um, these things. We can see the red blood cells, lymphocytes, white blood cells, which is neutrophil, this kind of thing, and basophil, this kind of thing, and platelets is a small like a star. You can see it easily here, and also we can have kind of sort our visualization to different category. You know what kind of like white blood cells shows in different way. Here's like a good thing that we can have. Here is the first one. This is a monocyte. You can see like this. And the lymphocytes, you can see like this. Basophils, we can see like this. Eosinophils, we can see like this. It's very useful for fighting against parasite in our body. And this one is neutrophils. And the small one platelets and then red blood cells. So regarding the pathology, when in the pathology condition, when the most common disease these days is leukemia. Leukemia is a cancer of blood-forming tissue, including bone marrow. So it has many types, but if I wanna categorize it, it can be on mild or chronic and acute. In acute things, the the patients are very symptomatic. They have easy bleeding, bruise, and weight loss, and with very low immune system and response. And the best treatment plan for the acute one is to do chemotherapy with radiation therapy, and at the end, a stem cell transplant. And for chronic and mild one, because some patients are asymptomatic, they don't show any symptoms, and it's better even if they are diagnosed with that, and like high number of the blood, white blood cells in their body, and they should be in the kind of observation and to control the disease progression and progress, and to stop it or to control it actually. And if you want to illustrate the kind of under the pathology, we can see the extraordinary number of white blood cells. It can be seen here, like basophils and type of neutrophils. You can see. So this picture illustrates CML, like called chronic myeloid leukemia. It's a chronic, and it can be managed by physicians. And this was the gist and brief illustration of what I learned in blood cells section.